All right. Well, welcome back to our lunch keynote program here at the 2022 Hawaii State of Reform Health Policy Conference. I appreciate you coming back. And I know this is, always a time when people are kind of energized and energetic. They've been engaged in conversation throughout the morning. And this is when we would all be back in the room having amazing chicken lunches and vegetarian meals and all of that great stuff at the Hilton Hawaiian Village. We'll muddle through in the virtual space. Of course, eat your lunch at your desk, and I appreciate you being with us. Without further ado, I want to jump right into our introductions for our keynote program here today. And we're really honored to have these gentlemen with us. They represent different parts of the community and the healthcare space and adjacent to healthcare. We've got Ray Vara, who is, of course, the president CEO of Hawaii Pacific Health, John Fink, the CEO of Aloha United Way, and David Lassner, the president of the University of Hawaii. Gentlemen, thanks for making time to be with us. Ray, let me start with you. Let me just ask you, as the head of one of Hawaii's most important healthcare providers, how is this latest wave of COVID treating the hospitals that you lead, and how is your team faring?
Yeah, thanks, DJ, and thanks for having me, and thanks for my colleagues here for joining us. I think this could be a great discussion. Look, this continues to be an evolution as we navigate what COVID brings to our community, and certainly there's never been a time when the public health has been more at the forefront of every agenda and what's impacting our community. And so our organization is I got to be honest, I couldn't be more proud of the work that they're doing. This is a very busy time. We are we know a few things about this current variant of COVID. We know that it's highly transmissible. Luckily, thus far, it seems to be presenting itself in a more mild fashion than previous variants. We know that those who are vaccinated, and specifically those who are boosted, fare much better and can likely avoid hospitalization, and certainly less likely to end up in our ICUs needing care. But all that being said, just because of the transmissibility of it and the far-reaching extent of it and the pure case volume, our hospitals are busy. Our hospitals are very busy. We've got several hundred people in the hospital across the state now. We've seen that grow over the last several weeks. But I think making that a little bit more challenging is the fact that the hospitals were busy before this current variant began to spread, because we know there's been a lot of deferred care and chronic disease management and things that people needed to take care of that maybe they hadn't taken care of over the last 18 to 24 months. So when you couple all those things together, it creates a very busy situation for our hospitals within Hawaii Pacific Health, but also the hospitals across the state. And the good news is our team, while they're just as at risk for staying healthy, they've done a phenomenal job of coming together and really putting the health and the needs of our community first. And so while it's a very stressful time, we know that this is what we were built for. We know that we condition ourselves to be resilient during this time, and we'll be here to meet the needs of the community. I think equally important, what we're very mindful of is the fact that any decisions that we make or recommend to our policymakers to make also have impacts on the broader health of our community. And those are the things that affect the social economic sectors of our community. And so while this is a difficult time, we think that that also represents progress based on the way we're seeing Omicron present itself. It's really representative of what I would consider the transition from a pandemic to an endemic. And so if we're able to just work our way through this over the next several weeks without instigating any significant policy changes in our community, we will serve the broader health of the community in a much better fashion.
Well, I want to just say to you and to Michael and Steve and everybody at HPH who puts wind in our sails, I really appreciate your support. And I know this conversation was one that HPH was really interested in having in terms of talking about the economy and the health of the Hawaii economy in general. David, I'll ask you a similar question about how COVID is treating you. You have to navigate getting kids back into the new classes of the new year, and are probably also thinking about this transition from pandemic to endemic. Give us a sense of where your head is as you are trying to navigate this crazy time with COVID.
So thanks, DJ, and thanks for the invitation to be here. Like Ray, I think our organization has performed extraordinarily well. The pivot was wrenching and immense for us back in spring 2020, and we did things nobody imagined we would be capable of in shifting in almost no time from to a almost fully online environment. And I think what we've learned since then is to be flexible and resilient. So we were ready to come back to largely in person. Then Delta hit. Then we were ready to come back to significantly more in person. And now we have Omicron. And we made the decision a couple of weeks ago that we would start our semester, which began Monday, largely online. And we are still expecting to return to significantly in person this semester once we start to see the numbers going down. But we've had limited cases. We were early with a vaccination mandate in the public sector and as a large employer in Hawaii. Our numbers have been good. Enrollment, we had the largest freshman class in our history at UH Manoa. Our community colleges are down, but we're down far less than across the continent or the state of California. We're probably a quarter of the decline rate. And best of all, our students are succeeding. So we're graduating students, even if we can't celebrate with traditional graduations. And we're having pretty good persistence from semester to semester, year to year. And that's one of the things that we've worried about. I just want to highlight a couple of positive things too, because it's easy to bemoan how tough this is, and it is tough. And our faculty, our staff, our students have been really resilient. And we've had a great relationship with our unions as well, working through telework and those things. And one of the things we've learned is that telework can work for many of the jobs. We were pretty slow moving on embracing, what's generically called the future of work, but many of the positions across the university can be done from somewhere other than on a campus. We were recognized by Forbes as one of the best employers in the state of Hawaii. I have to admit, it caught me by surprise, but I think this is part of it, is trying to be flexible and working with our employees. And if we get this right over time, hopefully we can recover and reclaim some space, lower our operating costs. I think we'll be doing a lot more online learning in the future. And I think that will be good for everyone. We were forced to doing more than we wanted, but it's a wonderful capability to have. And all of our faculty now are very literate in using the basic tools of online learning, which was not the case a year and a half ago. And finally, let me just say, it's really focused us, I think, much more on the needs of the state of Hawaii. And I think our whole university community has come to understand that this state cannot thrive into the future without its great public university really stepping up and prioritizing the things that the state needs from us. And depending on how the conversation goes, I can say a little more about what those are.
Well, that's a great topic I do want to come back to. I want to also say, as I said to Ray, thank you. And you and I have just gotten to know one another here in the last few days, but I'll tell you, the gentleman who's making this show happen, our producer, Alex Nelson, is a UH Manoa graduate, and he's nodding along, fists strongly in the air as you're talking. So I just want to let you know he'll be funding a future scholarship at your university.
Thank you so much. I appreciate that.
John, let me ask you sort of on the on this sort of spectrum of like resiliency to burnout. I feel like we have all gone back and forth there. And I think your community in the nonprofit sector, many folks have whipsawed back and forth much more maybe volatilely than some of our larger institutions. How would you sort of categorize or characterize rather the nonprofit community and the level of burnout, the level of exhaustion amongst your colleagues?
It's a fair question, DJ, and thank you for having me as part of this. I think that it has gone back and forth, and again, like everybody, just when you think we're out of the woods on this, we're right back into it. I think one of the things that's happened is that the nonprofits, one of the good things that's happened is there's been a lot more collaboration and partnership. Nonprofits often, because they're concerned about their own funding and making sure they get taken care of and take care of their constituent base, they don't tend to communicate perhaps well enough. And I think this has forced that because of the immediacy. The problem, as you just pointed out, is the immediacy has now been with us for almost 2 years. And just like every parent and every child who hasn't gotten to go through what we would consider a normal life over the last 2 years, whether people understand it or realize it or not, there is burnout, there is fatigue, there is duress. It's affected people. And I think we're all going to have to be very savvy and aware of that in terms of how we deal with it, not just in the nonprofit community, but just in the state in general on a going forward basis. I am happy to say that during the deliberations and the difficult times, I expected to be hearing a much larger number of nonprofits were either folding or merging, and that has not happened at this point. The people who have been giving, the companies that have been giving, the foundations, the federal money, the state money that's come in, all of that has helped keep a good portion of the charities alive. Can that continue much longer? I don't know. I don't know the individual state of each individual entity, but I think that would be of concern as they all do great work. And remember, what the nonprofits are doing is the work that the government cannot or will not do. And it really is granular on a lot of levels. And we need to keep the nonprofits healthy to keep our state healthy. And as I was kidding Ray the other day, one of our jobs is to try to keep people out of Ray's hospitals. And to do that, we need to make sure they have more economic sustenance, that they have shelter and food and health plans and knowing when to get checked so they don't have to end up in an emergency room. All of that has been compounded and more difficult due to the COVID situation. So I'm very pleased about the way the nonprofits have come together. I'm very happy the way the community has continued to support the nonprofits. Remember, one of the ways that nonprofits keep their names out there and get things done in the community is through fundraisers, dinners and lunches and golf tournaments and events like that. None of them have been able to exist for the most part for the last 2 years. That could take its toll at some point. But thankfully, DJ, I think that the people realize that the nonprofits do serve quite a large part of our economy. Our ALICE information, and for those uninitiated, ALICE stands for Asset Limited Income Constrained Employed. These are people who are getting by, but they're just getting by. So missing a paycheck or having a refrigerator blow up or a car go down puts them in a real world of hurt. There were almost 600,000 people who fit that category before the pandemic. We estimate that number is now closer to 700,000 or more. That's half the state of Hawaii is on the edge. Most of them have figured out how to deal with it, and they're incredible to be able to do that. But they can't keep taking the hits over and over and over again. And I think we just need to be aware of that going forward.
David, you had mentioned.
Can I jump in on that for a second? Because I think that's a really important point. And John, first of all, I want to tell you, I agree with you. When we think about our efforts at Hawaii Pacific Health in terms of being a leader in healthcare transformation, as well as what needs to happen in payment reform around healthcare, we will know that we've succeeded when the value of an empty hospital bed is greater than the value of an occupied hospital bed, because we have done something meaningful to change the health of the population. And while I think with each phase of these variants of COVID, it creates a different challenge, for the hospital setting and the physicians and the providers who are providing that care in real time. But again, I have to emphasize the points that you made around that at-risk population and the long-term impact of what we're experiencing right now. I think the numbers that I've seen that I think you just talked about in numbers of population is, but I heard it, but I think it was reported in March of 2020, the Alice population was about 42% of the population, and it's now somewhere just south of maybe 60%. Yes. That concerns me for the next decade and beyond, more so than necessarily what the next variant is going to bring to our healthcare system, because those are the things that, frankly, we were struggling to make an impact and support those the most vulnerable families prior to the pandemic. And it's going to take all hands on deck from all of us across all industries to address those things on a going forward basis as it relates to early childhood development, K through 12 education, post-secondary education, affordable housing, addressing houselessness, addressing food insecurities, all the things that you live with on a daily basis of helping to support those organizations. When I think of the true challenges and the economic issues and economic opportunities, frankly, that we have looking forward, it's around those areas as much as the care that we provide within our facilities. So I just wanted to highlight that, DJ, because I think what John's touching on is a really critical point as we look forward to the broader health of the community, which is, as you've heard me say before, and I stole this line, but poverty is the enemy of health, right? And so we've got to address that.
And if I can jump in, one of the scariest things I've seen that's an impact of COVID that exacerbates this challenge. We know that post-secondary education is the most powerful agent for economic and social mobility for individuals and their families, and it's an intergenerational positive impact. Just to throw one number out, a UH bachelor's degree is worth something like $1.5 million in additional lifetime earning over somebody with a high school degree. So we've been working hard for many, many years with the DOE and our Hawaii P20 Partnerships for Education program to get more of Hawaii's public school students to go on to post-secondary education. Doesn't have to be UH, it could be a private school, could be mainland school, could be military training, but they got to do something if they're going to position themselves and their families for success. We only could push that number up to 55% prior to the pandemic. So 45% of our public high school graduates were not going on to post-secondary training or education. That number dropped for the class of 2019 to 50%. So we lost, 5 percentage points, or 10% of our high school going rate was diminished. This year, the class of 2021, we lost, we're still down 4%. So fortunately, it didn't go down farther, but only 51% of our public high school graduates from 2021 went on to post-secondary education this fall. And that bodes really poorly for the future. So thinking about the direction we're heading, that's to me one of the scariest numbers. And that's all about COVID and the impact on those students and what happened to them in their last year or 2 years of high school, and what's happened to their families and the economic conditions they're in now.
And David, if you take that $1.5 million extra you would earn with a bachelor's degree and extrapolate it out, which I won't do right now, and you said if someone took 2 or 3 or 4% of that and put it away every year and invested it over the course of 40 years, now you're talking about a retirement opportunity. One of the things that concerns us is many people in their 30s and 40s who were on the bubble and couldn't qualify necessarily for rent relief, but needed help because someone had lost a job or was sick or whatever the case may be. They would go to their savings accounts, they would go to their family. And after that, unfortunately, we're hearing stories of people who would tap into their savings accounts or their 401ks. And if you're 35 and you've taken money out of your 401k, that's money you're not going to have in 30 or 40 years when you retire. And that's going to have implications for the whole infrastructure if we have an elderly population that doesn't have enough to retire on. So the implications and the ripple effect of what COVID did in forcing people to make decisions could be felt for decades on that stand.
But, all that being said, I also, I think there's reason to have optimism because, David, you probably won't say this, but I will. I mean, kudos are due to you and the P20 group for the work that got to the 55%, because I remember when that initiative first started, Hawaii Pacific Health was involved very early, and it was a stretch goal to be 55 by 2025, right? Is what I believe the original goal was. And so to have achieved that, and now of course it's been impacted, I have great confidence that you and that team can rebuild that and surpass that as we look forward.
I want to jump in on, if I may, to get a couple of questions from audience in on this. Beth Ann Kozlovich asks, healthcare education and the nonprofit community are challenged in the mental health space, which is challenging our economy on many levels, mental health issues. What will each of your organizations do going forward to increase response to mental health needs on the streets and workplaces or schools or in your organizations? Maybe put generally, how do you think about mental health for your community, for your workforce? Who wants to take a crack at that first?
Well, I'll start, but I think it's
I'll jump in too.
It's certainly we all need to do a better job of working together across the healthcare industry to make sure that we're filling those gaps to meet the mental health care needs of our community. It's probably one of the greatest areas where we have shortfalls in terms of resources and having been resourced across our industry and therefore across our community. But again, I think it's an issue that it's not something that can just be solved within the healthcare industry. I think this is a community-wide issue that, frankly, as I think about the people you have assembled today, we all have a part to play, a role to play in terms of addressing that issue. But I think it just is going to require much more clarity of focus in the future because the challenge, like a lot of these things, the challenges that we had in the pre-pandemic world are exponentially worse in the sort of post-pandemic view of things.
David, you want to jump in?
And for us in higher education, I don't think you'd find a higher education leader anywhere in this country who, before the pandemic, didn't have mental health services, particularly for students, on their top 10 list of areas that needed attention, investment, improvement. We've been fortunate that our sector received pretty substantial federal support to address costs associated with the pandemic. So we've been able to make some investments in mental health services for our students. And I'll just throw out one more positive thing. We were forced into this more than we might have done without a pandemic, but we are making far more use of mental health services provided through online services at a distance than we were beforehand. And that makes those services much more accessible than if you have to go into a specific office on campus and you wonder who's looking at you walking into the counseling center as you're going in. That stigma is still there. And I think we've all got to do a lot to reduce and eliminate the stigma associated with people seeking mental health support, whether they're our employees or for us, our students as well.
John, let me ask you this question from Eric Abe, who says, given how hard the nonprofit sector has been hit, he mentions healthcare also, but how hard the nonprofit sector has been hit by COVID, and in light of the Council on Revenue's huge revenue projections, his language, of course, should the nonprofit sector, should the healthcare sector be getting more meaningful relief from the state, in your view? What are these revenues? What does that mean for the future of how the state government engages with the nonprofit sector?
I think absolutely. And I think absolutely, as Ray said, that there's a great opportunity here for some positive proactivity and not just talking about dealing with things like houselessness and financial security and things like that. We need to be very smart about dealing with that now and not just talk about it and then table it for later, because there are people coming out of this that if we don't take care of them now, we're all going to pay the price financially for the difficulties they're going to go through and the pressure it's going to put on the safety net and the system. So absolutely need to be taking advantage of that now. And frankly, we need to be taking advantage of all this federal money that still hasn't been spent. Now is the time to be spending this. We should be spending this money now for the people in need and make sure that they are getting taken care of so they don't become further burdens on not only themselves or their family or the mental health professionals, but also on the entire state.
John, let me follow up with this question about tourism. If we're talking about the economy, the health of the economy, state revenues, the health of the coffers and the treasury, the role of tourism is part of that. It's a double-edged sword. As we think about the future of a healthy Hawaii economy, what role do you think tourism has in that discussion moving forward?
Well, if you go by what's happened over the past year, where we were surprised by the amount of tourism that came back so quickly, which is allowing us to have this surplus funding, I think we can all safely assume that we could go back to same old, and just completely ride tourism's wave, pardon the pun, into the future. That would be a grave mistake, because whether it's this type of a pandemic or an earthquake or something else, we're going to need other industries here that can not only provide additional revenues, but also support our kids to make sure they have jobs to stay here and they're attractive. And when David educates them, they can find somewhere to go locally to do it. So whether it's a rocket farm or whatever it may be, we need to come up with more options and opportunities to give people the space to say, Hawaii provides more than just tourism. And that's no knock on tourism, because tourism is obviously the golden goose. But as we found out, when you are so completely reliant on the golden goose and it goes away for a while, it gets very scary.
David, I know a lot of folks really enjoyed the fact that there were so many fewer tourists on the island. What do you make of this, the role of tourism in a healthy Hawaii economy?
Yeah, I want to say a couple things. One is exactly right. I think all of us who live here, while the pandemic was devastating, we also, I don't know anyone who didn't appreciate the improvements in quality of life for those who could go outside, of not having the impact of 10 million tourists a year on traffic, on beaches, on trails, on so much. So I think we need in my opinion, tourism isn't going to go away, but I think we could also do a better job. And I'm not an expert on what HTA is doing, but having an approach to tourism where we have more engaged tourism, maybe lower numbers, but some of their experiences, instead of just lying on a beach or being in a bed and breakfast or a vacation rental and shopping at Costco. Instead, we get them out for cultural experiences, guided hikes. Maybe they learn hula, maybe they learn Chinese cooking. I mean, we have so much to offer for tourists who get beyond the beaches, and nothing against the beaches. So I think that's part of what we have to do. We've got to do some shifting. And I think in doing things like that, we will also create more high quality jobs for the people who are directly engaging with our tourists, and hopefully at a somewhat smaller number as well. But I also want to follow up on John's point. While tourism is significant and will continue to be significant, we've got to do a better job of creating other opportunities, both for the students we graduate and for the many students who go off to the continent for college and then find that there's no job here for them to come home to. And I know that worries most parents. It's something the governor talks about all the time. And I think that's one of those areas where UH is digging in pretty hard to say, what is our role and responsibility? I don't think it's going to be about luring Google, Microsoft, Amazon to hire thousands of people here, but we have plenty of employers who hire. The National Security Administration and cybersecurity. They're begging for people to fill local jobs, ideally with local graduates. And that's a great example, because it's better for them to hire locally. They don't have to pay relocation costs, and they're likely to get a longer term employee that they won't have to replace. And it's better for us to prepare our kids for those high quality jobs that are here in Hawaii. So when you think about areas like data science, AI, machine learning, data visualization, conservation, resilience, understanding of climate change, creative media around movies and TV shows, food, agriculture, the technologies that we could develop here and export to other places. One of the things I've learned from many of my economist friends is we've got to think about economic activity that brings money in from other places, rather than just those sectors that recycle activity within the economy.
So give us an example of what you're talking about there. David, just real quick to follow up, what do you mean by, what is an example in your view of a sector that recycles money?
Well, most of healthcare. I mean, it's a huge part of our economy, but most of the money, of Ray's business is treating us who live here. So yeah, I want them reformed and more economical because it's good for us. But an example in that area would be if we figured out medical tourism in this state, then we would be bringing, and I don't know if it's possible, not my area of expertise, but then we would be bringing in money from other places. Our little piece of that, and it's not so little, is doing research in medicine and healthcare and health improvements. And we have great opportunities. We bring in primarily federal and sometimes philanthropic funds that wouldn't otherwise be circulating in this economy, creating great jobs while solving problems that are unique to Hawaii. And our special sauce is looking at health disparities of our incredible and diverse population and the differences between the cancers that affect Native Hawaiians or Japanese Americans or Pacific Islanders, incidences of non-communicable diseases in Pacific Islanders. If we aren't studying those things, nobody else will be doing that. We can improve our community and we can bring in dollars from elsewhere that circulate within our economy.
Ray, did you want to jump in on his comments?
Yeah, just to say that, I think my colleagues here did a nice job of laying out, the key issues. And I think to take it up a level, I think the overarching thing that we're all saying is that we don't necessarily have to emerge from this pandemic with the goal in mind of looking like we did when we entered the pandemic. We have an opportunity to reemerge looking very differently if we have the will to instigate that change. And that change can come in many of the forms that you've heard both John and David describe. But I know that's something that we've said within Hawaii Pacific Health is that we've forbidden the use of the term new normal because that implies that the future looks an awful lot like the past, and we really we don't want that to be the case. We think we have an opportunity to advance many of the strategic imperatives that we have for our industry, for our organization, and I would argue for our community if we so have the will to do so.
So,
well,
Ray,
and, the new industries aren't going to pop up tomorrow. They're not going to happen in the next 6 months or a year. And David mentioned a couple of them. But conversely, and I realize it's different from a tax-based standpoint, but if we all truly believe, which I think we do, that we live on the best place on earth, and since remote working has become the rule rather than the exception now, why can't we have people here getting great degrees at the University of Hawaii who work for think tanks and coding firms and Google and TikTok on the West Coast and work out of Hawaii, because that's what they're all doing. So I'm thinking, well, you don't have to live in Michigan to work at Google in San Francisco. You can live in Hawaii. And we need to keep looking at that as an opportunity to keep people here and provide them those types of jobs while still allowing them to live in Hawaii.
So
I
Ray,
think that's right. And I think one of the challenges, though, is those are hard jobs to get, at least at this point, fresh out of school. So if we think about our, a recent study indicated that Hawaii has one of the worst out-migration per capita percentages. And those are many of the, the Hawaii, it's our kids going off to college and not coming home. And so we lose years of productive contribution in Hawaii. So figuring out how to get them back as quickly as possible, because you're not going to land a job with a computer science degree from UH Manoa. Google's not as likely to hire you and say, oh, and by the way, you can stay at home, but we may get there. And then we're going to have to build those relationships with those enlightened employers who encourage that kind of work.
Ray, I want to ask you to follow up on your comments about the future being different, and specifically within the context that while costs for healthcare costs in Hawaii remain as low or the lowest in the country on a per capita basis and on many levels of reimbursement, and it's the healthiest or maybe the second healthiest state in the country. Nevertheless, the business community cites healthcare costs as being the number one or number two most important challenge they face in Hawaii. If we're looking, when we have this conversation 6, 7, 8 years from now, and we look back on this period, how do you think healthcare will be different in 8 years, 9 years? How will costs continue to be addressed? And what do you think quality looks like as a result of this COVID pandemic?
Well, that's that could be a doctoral paper on healthcare reform if I successfully answer that question. But the reality of it is all that you said is true. Is that right now healthcare costs represent about 18% of the GDP in this country. If left to its own devices and its current trajectory, by the year 2050, that number will be 38%. We will have long since bankrupted the country, and so we have to make a change. And so when we talk about being the leader in healthcare transformation and having a mission of creating a healthier Hawaii, it's really about focusing our efforts on bending that cost curve, so changing the rate of increase. And I think success would look to the extent if we could peg healthcare inflation here in Hawaii closer to what general inflation looks like. I think that'd be a good starting point for success. But we fundamentally believe within our organization that the greatest path to doing that is through providing the right care to the right patients at the right place at the right time. And so we're focusing on making sure that helping the folks understand that higher quality of care is by nature more efficient care. That where we choose to do certain procedures and care and provide care is important, whether someone needs to be in the hospital or whether they need to come in physically into a clinic, or whether we can do those things remotely, or whether we can do them in an ambulatory surgery center. Making sure that we're ordering the right tests at the right time based on the needs of the patient, versus just making sure that we're checking a certain number of blocks. And so I think there's a lot of work to be done, but again, it's under the fundamental principle that providing higher quality of care is more efficient care. And so if we have a healthcare system and an economic support infrastructure that values those behaviors, I think we'll make a lot of progress in terms of changing the path of the cost of healthcare in our community here in Hawaii, and I think be a leader and at the tip of the spear of what could happen nationally.
David, let me ask you this question from Catherine Finn Davis. She says, as the state desperately needs nurses and other healthcare professionals, how can UH facilitate the recruitment and hiring of qualified permanent faculty so that we can admit more students to meet the state's healthcare needs? I think she's talking about getting more faculty in to allow for more students to get through the pipeline. Maybe you could talk about faculty, but also how you think about developing the next healthcare workforce across many levels of credentials.
Yeah, I mean, there are a bunch of elements to that, and I want to thank, we have a lot of smart people who are working with we have a practice we call the sector convenings, and we've been working closely with the Healthcare Association of Hawaii, which surveys workforce needs. So short-term and immediate, when the governor realized that the revenues were coming in better than expected, he and I had a conversation about opportunities to make some modest injections of resources in his request to the legislature on behalf of UH. And one of the areas I requested help with that he supported, one is around increasing the nursing faculty in order to support additional nurses. And I want to thank the Center on Nursing, which is administratively affiliated with UH, but we don't run it. It's a statewide kind of center that looks after this area. And so the governor is asking the legislature for resources for that, specifically for faculty. We are also looking at, and Ray and I have been in multiple meetings about this, the need to increase the number of medical residencies on the neighbor islands. We know that the best predictor of where a doc will practice is where that doc does their residency training after medical school. And we don't have as many positions for residents on neighbor islands as we need. So the governor is supporting a request from us to expand that as well. So those are some of the things, but I think when we look at for UH, our next round of strategic planning, which we're starting just now, absolutely addressing workforce shortages in key areas like healthcare. And I'll just throw out one more. I've challenged our education people to say, what would it take to actually eliminate the teacher shortage in Hawaii? What would that look like? Rather than bring in hundreds from the continent each year when we know most of them will be gone within just 3 to 5 years.
I want to give each of you an opportunity to answer sort of this more hopeful question. And we'll start with you, John. As you look out on 2022 with all of the context of COVID and everything else that's going on, what is it that gives you most hope about the year ahead of us?
Well, I think we're finally going to get out of this. And I think everybody's had this overbearing cloud over their lives in so many ways. And I think we can start getting back to whatever the new normalcy is going to be. And one of the things we have here is an amazing capacity. What is that, Bachi? Sorry, I didn't
Ray
say
said
that
you can't
last
say
year.
new normal.
Yeah. Oh, the new normal. Oh. I do think we have a great sense here because this is the land of aloha, and I don't mean to sound corny or anything, but I do think we will have a better capacity to bounce back because by their very nature, people here are just more decent and nicer. And so it might be easier for people here to get back to the way it used to be. So I'm very optimistic that hopefully by the summer, that as Ray mentioned, if this thing turns from the pandemic into an endemic situation and we're looking at maybe once a year vaccines or whatever the case may be, we can start moving forward. I just don't want us to lose this opportunity. And you don't want to take advantage of a horrible situation, but we have to. And we need to start looking for other ways to do things to make sure that we don't find ourselves right back here in another couple of years, whether it's with an act of God type of situation like a hurricane or another pandemic. And hopefully we've learned some lessons from this. So I'm optimistic that really smart people will come up with some ways to move forward. And two of them are my colleagues right here. So that's a good start.
David, how about you? As you look out onto 2022, what gives you hope?
I don't have a whole lot to add. I'd say I think we've demonstrated incredible resilience as a community that we really could have been broken by this. And I know a lot of people have been hurt badly and a lot of people have died and a lot of families have been devastated. But I think we've also seen a really strong sense of empathy. I think we've seen a lot of our institutions that were perceived as static, really adapting and willing to change, ours included. And I think we all have a greater understanding of what we have to do differently. We may not yet know exactly how to do it, but we know we can't just sit still and try to get back to 2019. I don't know anybody who really believes going back to 2019 is what we're all about, and that is exciting.
Ray, how about you? For 2022, you look out, you see what that gives you hope?
Yeah, that's a great question. And I've said this, I think, pretty consistently since early on. And it's the collaboration that I've experienced throughout the course of the pandemic. And if that frankly didn't exist at the same level in the pre-pandemic environment. And to the extent we're able to carry that forward, it'll bode extremely well for our community. I mean, just the fact that I'm sitting here on this call, having this discussion with John and David, given the roles that they play in our community. And I think all three of us would say that there's not a week that goes by that we don't engage with policymakers, whether it's at the legislative level, it's at the county level or at the state level, alongside with the not-for-profit community, the educational folks, the healthcare folks, the public health folks out of Department of Health. We're all having conversations in a way that is so different than it was in the pre-COVID environment. And when you have cross-sector leadership and folks coming together to solve common issues for our state, I don't think you could ask for a better platform to make a positive outcome in our community. And so if we're able to sustain that, just that spirit of collaboration amongst cross-sector leadership, Hawaii is going to be a much better place beyond what we already know about how special it is today.
Ray Var, our President and CEO of Hawaii Pacific Health, John Fink, the CEO at Aloha United Way, and David Lassner, President of the University of Hawaii. I thought I messed your organization up there, John. It was a fluke thing, but I appreciate all of you gentlemen being with us.
I put it up here behind me just so you wouldn't do that.
Well, I should have paid better attention. Thank you all for doing that. I appreciate it.